welcome to my channel. Today we're going to be talking about specific phobias. We're going to talk about the 5 types of specific phobias, the causes, the treatments, and the characteristics to be diagnosed with a specific phobia. According to the book Abnormal Psychology, a specific phobia is defined as an irrational fear of a specific object or situation that interferes with an individual's ability to function. So, in the earlier versions of the DSM, the specific phobia was originally called simple phobia, but we all know that it's much more complex than just a simple phobia. So, a quick little backstory: Phobos, meaning terror or fear, was a Greek god who traveled into battle with his father, Ares, the god of war. So some characteristics of specific phobias is the lifetime prevalence is about 13%, the 1 year is about 9%, the female to male ratio is 4 to 1, so that's pretty high for females to have that, except for heights where it is equal. Without treatment, it is a chronic course, so you would need to go get help. The onset is about 7, and Hispanics to non-Hispanics ratio is 2 to 1, which is twice as many, which is still high as well. In order to be diagnosed with a specific phobia, according to the DSM-5 diagnostic criteria, you must have an extreme and irrational fear of a specific object or situation. There is a significant impairment in social, occupational, or important areas of functioning. The fear is recognized as unreasonable, and the avoidance of the fear is persistent, typically lasting longer than 6 months. There are 5 types of specific phobias. There's the animal type. This is frequently acquired in childhood. This can also include insects. There's the natural environment type, where you're afraid of heights, storms, water. This is usually weather-related phobias. There's also the blood injection injury type. This is a different kind of physiology. It's a strong sympathetic with a strong parasympathetic response. There's also a situational type, where you're afraid of airplanes, elevators, enclosed spaces, etc. And then there's the other type of phobias. There's just so many things you can be scared of. Psychoanalytical theory suggests that the internal conflict is central to what is really going on. Within that, there are 3 types of anxiety. There's the objective anxiety. This is a realistic anxiety. The ego interprets an anxiety or a potential anxiety, and some of that includes like job loss, divorce, etc. There's also a neurotic anxiety. This is a danger from the inside, or the id. Phobia is a way for the id to express anxiety, confronting an unconscious problem. There's also moral anxiety. This is the fear from the conscious. So, besides the psychoanalytical theory, there's also a biological theory. This is just saying that the fear is genetically passed down or transferred. So, I'm not going to really get into much of that. What I do want to talk about is the 3 learning pathways. This is conditioning, observational learning, or misinformation that causes you to have a specific fear. So, conditioning is like there's a story, Little Albert, it's not a story, it was actually done, but he was introduced to a little white fluffy rat, and every time he would get the rat, a loud noise would go off. So eventually, after this kept happening, they kept giving the Albert, or Little Albert, a rat, and every time he would see it, they would make a loud noise. So then eventually he would just become scared of white fluffy things. Observational learning is basically children, or anybody I guess, but mostly children, say your mom was scared of dolphins and you would go to the beach and she would see a dolphin, you would probably be scared of a dolphin too, just because your mom was scared of a dolphin. There's also the misinformation concept that's being told that an object is dangerous. I wanted to tell a story about this because this actually happened to my mom. My grandma used to tell my mom and her siblings when she was younger that if they didn't wear underwear to church, that the house would burn down. Well, my uncle didn't wear underwear to church one time, and the house actually caught on fire. They came back home and the house was on fire. So my mom kind of has this weird fear, like, you know, if we didn't wear underwear as a child, that our house is gonna burn down. So when we were younger, we always wore underwear because my mom had that fear that our house was gonna burn down, because hers did when she was younger. Lastly, I want to go over is the treatments for specific phobias. The best therapy is the in vivo exposure therapy. First, you start off with relaxing, then you're exposed to stimulus gradually. And this happens over a course or a period of time. Um, there's also the flooding. This is more of like a full force. It's just all at once. They're going to expose you to your fear all at once. The thing about flooding therapy is has a high dropout rate. I think this is super cool. This is my favorite. The virtual reality exposure therapy. This can help with PTSD. Obviously in the picture above, it looks like soldiers being exposed to most likely situations that they went through overseas or whatever they have experienced that made them have anxiety. So that's it. Thank you for watching my video on specific phobias. I hope you learned more of what specific phobia is, a clinical description, what types of specific phobias there are, the causes, and how to treat it. So my name's Amanda Rodeman. I hope you have a good day. Thank you.